Welcome to the James Rice Show and this special update on the coronavirus. And I'm happy to welcome Miss Jennifer Rice, an emergency room nurse and now a nurse practitioner from Edmonton, Canada. Welcome to the show, Jennifer.
Hi, thanks for having me.
Now, just full disclosure, Jennifer is my niece. And she's working out in Edmonton, but she was telling me just before we went on air here that she worked with the Ebola virus in 2015 when it hit in Ontario. Is that correct?
Yes. So these types of serious transmittable pandemic infections are definitely very anxiety-provoking for healthcare providers. And the threat is very real right now.
So what do you think is happening in the ER in Wuhan, China?
So it's hard to speak about what's happening in China. I don't know what's happening there. It seems to me, by the sheer number of cases that are coming out of China and the fact that they seem to have locked the city down, I don't really know what their standards are for respiratory precautions and kind of if they had policies in place and if their staff had appropriate training prior to this outbreak. But it is concerning seeing how there's a huge number of cases there. I'm definitely concerned that maybe the best practices for infection prevention are possibly not being followed there.
So what are those best practices? What should we be seeing and being done? Because we see these people in the hazmat suits with with their faces all covered and walking around in their white suits with the blue booties, and it seems like there's lots of precautions going on. But what do you?
So I know in Canada here we have incredibly high standards of infectious disease practices, and not only that, we have a lot of training. So working in the emergency room, we had to do annual training for preparing for a mass infection outbreaks such as this coronavirus. So basically what we would need to do is definitely, you're right, have a full protective suit covering all of your clothing and exposed skin. We would usually wear 2 pairs of gloves as well as booties. Definitely eye protection with goggles. We would have an N95 respirator on, which the N95 respirator is a special respirator that is fitted to your face. There's special testing that you have to do to make sure you have the correct size. And then we would be in a full hood. So the hood is kind of as you would imagine a hood would be. It comes up from the back of your protective suit, and it covers your whole head and face. So I haven't been seeing a lot of the hoods being used on the images that I've seen coming out of China. But as emergency room nurses in Canada, we are trained to put that protective gear on properly as well as take it off properly.
And I'm not seeing any of this. I'm not seeing any of this N95 masks or breathing apparatus or anything on the nurses either.
And they're expensive. That's probably why the N95s are actually quite expensive. I couldn't give you a dollar value for each mask, but I know they don't come cheap.
But they're just wearing the regular masks.
Yes, which I'm afraid. So it is transmitted through droplets. So any coughing or sneezing. So the little surgical masks would offer some type of protection. But when you are working with an individual who you know or is concerned that they are infected with the virus, these special N95 respirator masks are snug to your face 100%, and there's absolutely no way of the respiratory virus to get into your mouth or nose with that.
And that's fitted for you specifically.
Yes.
Your mask.
So if you gain or lose 10 pounds, you have to be refitted. You can't have a beard or a mustache. There's a lot of really strict policies and protocols that are followed here in Canada for that to
Okay,
protect healthcare providers.
so I'm flying through Los Angeles and landing in Toronto, right through a couple of coronavirus airports that people landed in, and I'm seeing people wearing these masks that they bought at the local Walmart. Does that help us? Does this,
I mean, it would offer some protection, yes.
like, what percentage? What percentage? What are we doing?
It's hard to say. So it's the most important thing is to avoid touching an individual who's sick. So shaking someone's hand or touching something that a sick person has touched and then touching your mouth, face, or nose. That is the way of the transmission of the virus. So as far as how much protection you would get out of a simple mask that has openings, I can't quantify it. Maybe 50% reduction in risk, but the biggest reduction is touch, or the biggest risk I would say is touching a surface or shaking hands with a sick individual and then touching your eyes, nose, or mouth or face without washing your hands. That would be the highest risk for transmission.
Okay, so is it true? Because, I read this on the internet and everything I read on the internet is true. Is it true that, if I'm wearing my mask and then I take my mask off to eat some food and put my mask back on, so I'm using my fingers around my mouth, it's just dangerous to do that?
Yeah, totally. That's completely dangerous and defeats the purpose of wearing the mask. Yeah.
So if you're going to wear a mask, do not touch your face. Do not take it off. Go out, wear your mask, and come back in. Is that what you're advising?
So yeah, I would say wash your hands thoroughly for 20 seconds with soap and water before putting the mask on. And then when you're about to remove the mask, make sure your hands again are thoroughly washed for at least 20 seconds. Remove the mask, dispose of it safely. Don't just leave it sitting on a table where someone else has to touch it. And then again, wash your hands.
Now, let me go back to this N95 mask for a second. Are they wearing some sort of oxygen thing with it?
No. So you can still, so the beauty of the N95 is you can breathe out, but the way of the mask is designed is when you inhale, it is filtered all the particles in the air. So you're just inhaling clean, virus-free air.
So it's like a Brita water filter, like a,
kind of.
You're wearing that. Okay, so let's go back to the emergency room now. And a lot of stuff that is coming out through the Twitterverse is from the nurses specifically, who are reporting, how overwhelmed, how frustrated, how angry they are right now with the situation. What are they feeling over there? What is going through those nurses and doctors' minds as they're trying to grapple and understand and handle this situation? What do you think is going on?
Sure. Yeah, it's definitely scary. So in my experience working as an emergency nurse, I actually worked with quite a few of the nurses who had been working at North York General and hospitals like that in Toronto during the SARS outbreak. Back in the late 90s, early 2000s, and they actually lived through that fear. So I really got a firsthand experience of what they went through. So it was really scary going to work every day and thinking, am I going to contract this virus? Is this worth it? Could I be bringing this virus home to my children? If there is a confirmed case and you have been exposed to that person, now you're put on quarantine, your whole family is put on quarantine for 10 to 14 days. So it's actually extremely anxiety provoking and scary, especially in the emergency room where you have no idea what's coming through the door. So the precautions in the emergency room we used to take, and we use this with Ebola, and I'm sure they're doing this now, is all of the nurses who are working in triage, which is the very first point a patient has with a medical provider in hospital, are totally in their personal protective equipment for their whole shift. So that includes the N95, the hood, which even that alone is physically
exhausting,
difficult.
right? It must be exhausting.
we would do maximum 4 hours in that shift because you can't drink water. The masks, the N95 masks, after about 3 or 4 minutes, you have to work to breathe in those. It's not like breathing normally. This is a heavy mask that sits very tightly to your face. You're very hot in your equipment. It doesn't breathe. So, it's definitely trying. And it's very scary. As healthcare providers, nurses, doctors, we're always taught to put the patient first, especially in the emergency room. You're used to dealing with very sick patients in critical situations, and we just kind of jump right in. One thing I read after SARS happened, there was obviously a lot of reports and cases that came out, and this has always stuck with me. In a critical situation, you always think ABCs, airway, breathing, circulation. But after SARS, nurses and doctors, they said that A was, are we safe? So if we don't feel like this is a safe situation, everyone stop, put on your personal protective equipment, and then see the patient. So I think that nurses and doctors right now, and we have had a lot of experience with SARS, Ebola, the Middle Eastern coronavirus, now the new coronavirus from China. So we are very well trained in preventing these infections from spreading and protecting ourselves, because it's definitely extremely scary.
Yeah, well, Canada is definitely well
Yes.
prepared. I mean, we've done a
Yes.
lot in the last 17 years since SARS, but I mean, I can't imagine. I mean, those nurses are working, they're not working 4 hours and then getting out. I mean, they're working a lot.
Yeah.
I mean, they had to be 12, 14, 16 hours. I mean,
Yeah,
they
definitely.
must be just exhausted. I mean,
And probably,
don't you just want to give up? I mean, through that situation, like you're a nurse
yeah,
and you're saying, forget this, forget it. I'm out of here. I'm walking out because this is too dangerous. Why
yeah.
stay? Why stay there?
So I guess a lot of nurses, just, it's their passion. They want to help people, right? That's why people get into nursing. Trust me, it's not for the money. It's not for the glory. You just really have to be that type of person who wants to help others. And, I think for the nurses too, it's probably very frustrating because they see what's going on in the front line, and they're probably escalating it to their administrators and health officials within the city and country, but they might not be getting the support they feel they need, which is also incredibly frustrating when nurses know that, things aren't being done properly and the virus continues to spread. That can be incredibly frustrating as well.
I really feel for them. I mean, Donald Trump wants a Nobel Prize, but man, those nurses in Wuhan,
Yeah,
given
definitely.
a medal or I don't know, some sort of something, because what they're doing there, I can't imagine. Just based on what you're telling me, is incredible. Now,
Yeah.
what are you taught as an emergency room manager or nurse or administrator? What are you taught about this kind of mass panic? Because we're seeing videos of lineups and people crying and screaming and patients fainting in the emergency room. I mean, it's overwhelming. What are you taught about how to handle situations where there's just pandemonium?
Sure, definitely. And, a lot of people think of the emergency room or a hospital as somewhere that's safe. They go there to seek refuge when they're scared, when they're sick. So when they feel unsafe in that area that had previously been a safety net for them, that can definitely ensue some fear among patients. So especially patients get scared when they see healthcare providers in personal protective equipment, and they feel like they're not protected because they're just wearing their own clothes. So just explaining to patients that, we are wearing our protective equipment because we have a higher risk of being exposed to high risk interventions like putting on an oxygen mask and being very close to somebody who's breathing. We try to reassure patients that the majority of people who are infected with coronavirus or these types of viruses usually are people who are immunocompromised, for example, somebody with HIV or somebody with another comorbid condition like a chronic lung disease. young, healthy people are less likely to be infected. And just reminding patients, make sure you're washing your hands. Don't come to the emergency room if it isn't a true emergency. We try to, tell people if you just need a prescription or you need stitches, try to go somewhere like a walk-in clinic or an urgent care.
Well, that's a good point, because I'm wondering, I'm thinking like, this is flu season. I mean, everybody gets the flu. How do you know if it's a flu or if it's a coronavirus and you're in a panic?
Yeah, it is true. So a lot of the symptoms are very similar, with fever, cough, shortness of breath. And, this is the height of influenza season as well. So the CDC is actually recommending people get their influenza vaccine right now. So there's less risk of people showing up with flu-like symptoms when they actually have the flu, because then, of course, we have to treat them as if they could potentially have the coronavirus. So definitely making sure people have their flu shot.
So wait a minute. What you're saying is, if I show up to, I'm going to ask you this, if I show up to the emergency room with flu-like symptoms, would you treat me like a coronavirus person?
I think so, definitely. We can't, especially somebody who has recent travel.
Okay.
Yeah.
Because I went through LA.
Yeah.
And
any travel within 21 days would be enough to probably put you on precautions.
Wow.
Yeah.
So what would they do? They would put you in sort of your own little room and in a bubble?
So you'd be in a room that usually has reverse like air filtering. So it's a heavy glass door. So then
the air can't get out.
The air is filtered, and can't get out to other patients. Exactly.
Wow.
And unfortunately, we don't have tons of those rooms. Like most emergency departments only have maximum 2 of those rooms. So it is definitely really scary when those rooms are full and you have patients coming in with symptoms. But we do have kind of rapid nasal swabs that can detect the virus or detect influenza. So obviously, if it's just influenza, that person can be kind of managed differently as opposed to somebody who tests positive for coronavirus.
Okay, so you have like a quick swab test that you could do.
So there is a swab up the nose. Okay. That's the only real diagnostic tool that we have for coronavirus.
Okay, so all right. So if this happens in North America or Canada, don't panic. If you got the flu, you're not gonna. They can do a test. Okay, good. All right, well, that's good. But there are people like lying in the hallways in China. with in the bed.
Yeah,
they don't have the room. They don't have the space.
China right now. Yeah, and I think there's over 2,000 cases in China. Like, that's a lot.
Well, that's confirmed. That's confirmed.
Yeah.
And some of the nurses are saying 90,000.
Yeah, and that's the thing too. You can never trust really what's coming out on the New York Times or what they want. Like, they're probably keeping it hidden from the West, as they did with SARS, right? So yeah, the nurses there probably are the only true ones who actually know the truth of what's going on there. And it's probably very scary times for them.
Now, I know you're flying out this week to go to New Zealand. Now, how worried are you?
I'm not going to lie. I am a little bit worried. I am a young, healthy person. But being on an airplane for 16 hours with people coughing and sneezing and not breathing filtered air is a little anxiety provoking for me. So I definitely am going to be bringing my hand sanitizer and maybe even purchasing a little mask from Walmart, anything to protect myself. But I mean, overall, they're saying the risk is fairly low, especially here in North America. I'm not flying through China, so that's reassuring. But, if I was an older person or traveling with a young child, I would probably reconsider during this time.
Okay, so obviously people with any health conditions, they also, and if you're young, willing to travel, it's, get a mask, get a hand sanitizer, and just be careful. Just be careful if somebody's sneezing or coughing around you, obviously. And if you are sneezing or coughing, don't travel, right? That would be good
Please,
advice.
yes. Yeah.
If you've
If
got
you
the
are
flu,
sneezing or
but
coughing, please cover your mouth. Please be diligent with your hand hygiene. And if you are sick, don't travel and seek medical care.
yeah. But I mean, obviously, the coronavirus is coming right now through people who have been in direct contact with people from Wuhan or who have been in Wuhan.
Yes.
So
Yeah,
not everybody who has the flu has the virus. But
exactly.
if you have had contact with anybody from that region, get to the hospital. And if you're feeling any
Mm-hmm.
flu viruses, that would be the good advice. So that's what you now. One of the things I wanted to mention was about health conditions. Obviously, breathing conditions. What about? I hear diabetes is if you have diabetes, you're at higher risk.
I'm not too sure about that.
No, okay,
People with diabetes are at risk of certain infections, like, for example, skin infections. I guess if your diabetes was poorly controlled, you would be at higher risk of infections. And, this could be a risk for people, any comorbid chronic condition that is, poorly managed or poorly controlled. I would say there could be increased risk, yes.
And what about people with asthma? Anything like that? Would there be any issues there?
Asthma, there could be with, I guess if the person was already having, it's hard to say. I don't know if there would be any increased risk with asthma, but a person with asthma who was exposed to the coronavirus, the symptoms of coughing and shortness of
Right,
breath, they could just think that's a typical asthma attack.
right. It could be more
So
serious, obviously,
it
for
could
them.
be more serious.
Okay.
Yeah. So just
Okay.
knowing who you're in contact with and where they've been.
All right. What other piece of advice would you give to the listeners for this virus? Should we be panicked? I mean, do you feel a bit panicked?
I'm going to say try not to panic. So, influenza, the basic flu virus, kills 35,000 people annually in North America. So, viruses do kill people. Influenza kills a lot of people. I think we have 56 confirmed deaths so far. So compared to influenza, this is pretty small beans.
But
So
it's
I'm
panic
saying try
because
not to panic.
we have this kind of fear in our brain. Something clicks, right?
Mm-hmm.
We don't know what it is. We can't see it. We have this incredible fear.
Mm-hmm. So try not to panic. I think the most important thing with the World Health Organization is advising is just diligent hand washing. Avoid touching your eyes, nose, mouth, lips with unwashed hands. And that's the most important thing. There's no current travel restrictions for the World Health Organization other than those in Wuhan. But as far as other general travel, there's currently no restrictions as per the World Health Organization. So just trying to, hand hygiene is the most important thing in my opinion.
All right. Well, this was a fascinating discussion, and thank you so much for enlightening us on what's happening in the emergency rooms and what those tremendous nurses are going through.
Well, thank you so much for having me, and I'm just praying for a speedy resolution of this virus, and hopefully the number of cases start to decrease and there is no more deaths.
Thanks, Jennifer, and to the
Okay.
listeners of the James Rice Show. We will try to keep you updated on any new information that we may have and may receive, and as we try to reach out to more people and keep you as best informed for those who are thinking about studying abroad and traveling abroad. And remember, guys, be safe, but always try to be a little crazy.